Hi, I'm Dr. Gulani. I appreciate your interest in pinguicular and pterygium surgery. As you know, these are small bumps on the white of your eye that are yellow and they can get red and look pretty nasty and affect not only the appearance of the eye, but also, in extreme cases, impact your vision besides affecting the ocular surface and the tear film. So, as you know, for over 3 decades, I have pioneered the technique of no-stitch pterygium surgery and pinguicular surgery using human placenta, where there is no stitch, there is no injection, no needles, and by doing this surgery have produced results that have really fascinated me and become a real passion. In fact, I shared my data and work with eye surgeons all over the world in a recent textbook that I wrote for eye surgeons on this surgery called Art of Pterygium and Pinguicular Surgery. So besides the textbook, I've also published many papers, written articles, of course, teach all over the world, have even invented unique surgical instruments with Bausch & Lomb, which help me with this surgery and make it uniquely artistic, because this is really a very intense surgery for me. You know, I say this in relation to this surgery, even if your plastic surgery goes bad, you can cover it up, but this surgery is intense. Your eyes are open all the time, so it makes the surgeon very accountable. Though this is a difficult surgery for me, because not only do I want to remove the entire lesion, it's called the Gulani iceberg concept, meaning what you see on the white of your eyes, those little growths, are actually it's much bigger than that. So you have to chase it right down to where its roots are. And that's the reason for my very low to non-recurrent cases of pinguicular and pterygium surgeries. That's the biggest secret, is the dissection. And then, of course, using the human placenta, which is, of course, lab tested, comes from the company, completely free of diseases, completely checked, and compatible with your eye, and looks like glistening, makes your eye look so nice and white from the very first day. And it is known over 3 decades by all my patients all over the world. Day 1 after surgery, I make them walk up to the mirror. I call that the mirror test. But they look at their eyes, and that's why this technique is also called SPARKLE. It's an acronym for sutureless pterygium amniotic reconstructive surgery with lamellar keratectomy. So this surgery allows me to have that confidence. Many of you have come to me nowadays with previously complicated pterygium pinguicular surgeries, recurrences, or badly done dry eye treatments. That does lower my incidence of how I can predict, but still I want every surgeon to try this concept technique and raise the bar on making you look good and see good. That's very important. Another important aspect that I get a lot and I explain to my patients is most of these pinguicular pterygium surgeries are inherently associated with dryness. So you always have dry eyes with this condition going on in most of the cases. That's where my moist therapy comes in, which is a proprietary therapy now registered by the US Patent Trademark Office. You can again go online on our website, read about the moist therapy. I even do moist therapy first when patients land, then proceed with surgery, pinguicular pterygium, in a day or 2. Moist therapy takes about 15-20 minutes. Pinguicular pterygium surgery takes about 30 to 40 minutes. We do it under mild sedation. You're in La La Land. We do it in my beautiful surgical spa, the world's first eye surgical suite, where in the beautiful ambience of music and lights and no needles, injections, you're having this surgery and you walk out of surgery. And then I just love to look at you all the next day post-op and then follow you all for the rest of the life. So we've been doing this for over 3 decades, have shared our data of over 2 decades, written a textbook on this. And not only that, I teach courses on pterygium surgery nationally, internationally. It's a passion for me. So another important aspect that comes with this is many of these patients with pinguicular pterygium wear contact lenses or glasses for vision. They might be nearsighted, farsighted, have astigmatism, or reading vision issues. Another procedure I've developed and registered at the US Trademark Patent Office, laser plastic, not LASIK. I don't want LASIK in cases like y'all, because by cutting the flap, that affects the pinguicular pterygium and also causes more dryness by cutting the nerves. Laser plastic shapes you without cutting, particularly developed for these cases of pinguicular pterygium, and makes you see without glasses. So when you come to me with pinguicular pterygium, not only am I trying to see if I can make you look good, I also want you to see good. So I approach it holistically, correct the tears part with the moist therapy, the dry eye part, treat the surgery, the human placenta, no-stitch surgery for your pinguicular or pterygium, and then also correct your vision, laser plastic. And I may do this in different stages or combinations based on your unique situation. Is your vision worse than your pinguicular? Is your pinguicular worse than your vision? Is your tears worse than everything? And if there are any associated conditions, including you can have premium cataract surgery if you're of that age, where you're in your 60s and I'm doing your pinguicular pterygium. I can even do cataract surgery to make you see distance and near putting in premium lens implants. So having performed all these techniques, having seen practically every presentation of pinguicular pterygium from all over the world with patients from different cultures, different body types, over 70% of my practice is also fixing complications of patients who've had pinguicular pterygium surgery elsewhere. So it's very important that you understand this. Question your surgeons. Don't jump into any surgery. Do not fall for any deals, hype, or advertising. Look for publications. Sit down and ask for techniques, and only then go for surgery. Because this is elective surgery, remember. You don't need to. It's elective surgery, but it has to follow a protocol. Though no surgery can guarantee 100% results, I want every surgeon to fight for that outcome. So if you have pinguicular pterygium, you have reddish, yellowish looking, tired looking eyes, do not despair. Me and my amazing staff at Golani Vision here in Jacksonville, Florida, look forward to welcoming you for your eyes. Dr. Golani.